Question 1. Which action best demonstrates the nurse's role in preventing hospital-acquired infections? A. Wearing gloves for all patient interactions. B. Washing hands before and after patient contact. C. Using sterile technique for medication administration. D. Wearing a gown when entering any patient room. Answer. B. Washing hands before and after patient contact. Question 2. Which situation requires immediate intervention to prevent harm? A. A patient ambulating within 4-pole. B. A patient using the call bell for assistance. C. A confused patient attempting to climb over bed rails. D. A patient asking for pain medication. Answer. C. A confused patient attempting to climb over bed rails. Question 3. What should the nurse do before administering a medication to ensure patient safety? A. Ask the patient if they've taken the medication before. B. Scan the medication, but skip barcode scanning the patient. C. Confirm the patient's identity using 2 identifiers. D. Rely on room number to confirm the patient. Answer. C. Confirm the patient's identity using 2 identifiers. Question 4. Which behavior by a UAP requires correction by the nurse? A. Placing the bed in the lowest position after care. B. Assisting a patient to the bathroom without checking the care plan. C. Recording vital signs in the electronic record. D. Reporting abnormal vital signs immediately. Answer. B. Assisting a patient to the bathroom without checking the care plan. Question 5. Which task is most appropriate to delegate to a UAP? A. Educating a patient on anticoagulant therapy. B. Monitoring for signs of bleeding. C. Assisting with ambulation after physical therapy. D. Administering a subcutaneous injection. Answer. C. Assisting with ambulation after physical therapy. Question 6. A nurse notices a frayed electrical cord on an 4 pump. What should be done? A. Continue using the pump and report it later. B. Unplug the pump and tag it for maintenance. C. Wrap tape around the damaged area. D. Ask the patient to avoid touching the pump. Answer. B. Unplug the pump and tag it for maintenance. Question 7. Which patient is at the greatest risk for developing a pressure injury? A. A young adult on bed rest for 24 hours. B. A post-op patient ambulating independently. C. An elderly patient with limited mobility and incontinence. D. A middle-aged patient using a wheelchair independently. Answer. C. An elderly patient with limited mobility and incontinence. Question 8. A nurse finds a patient's side rail down and the bed in a high position. What is the best action? A. Raise the side rail and lower the bed. B. Call the provider immediately. C. Ask the UAP to reposition the bed. D. Document the safety issue in the chart. Answer. A. Raise the side rail and lower the bed. Question 9. A patient receiving a blood transfusion begins to complain of chills and back pain. What is the priority action? A. Document the patient's complaint. B. Notify the provider after finishing the transfusion. C. Stop the transfusion immediately. D. Administer acetaminophen. Answer. C. Stop the transfusion immediately. Question 10. Which action reduces risk during medication administration? A. Preparing multiple patient medications at once. B. Checking the label 3 times before administration. C. Relying on memory for medication dosages. D. Allowing interruptions during MedPass. Answer. B. Checking the label 3 times before administration. Question 11. What is the safest method for transferring a patient from bed to wheelchair? A. Pulling the patient with their arms. B. Lifting the patient under the armpits. C. Using a gait belt and assisting slowly. D. Encouraging the patient to slide off the bed. Answer: C. Using a gait belt and assisting slowly. Question 12. What should the nurse do to ensure safe use of restraints? A. Tie the restraint to the side rail. B. Document restraint use once per shift. C. Use a quick release knot. D. Omit physician orders if family consents. Answer: C. Use a quick release knot. Question 13. Which is a priority nursing action after receiving a verbal order for medication? A. Document it after administration. B. Administer it immediately without questioning. C. Read back the order to the provider. D. Ask another nurse to verify the order. Answer: C. Read back the order to the provider. Question 14. A nurse is teaching about fire safety. Which acronym is most relevant? A. PASS. B. RACE. C. CODE. D. STOP. Answer: B. RACE. Question 15. A nurse is caring for 4 patients. Which one should be assessed first? A. A patient scheduled for discharge later in the day. B. A patient requesting assistance to the bathroom. C. A patient who had a fall in the previous shift. D. A patient waiting for a dietary tray. Answer: C. A patient who had a fall in the previous shift. Question 16. What is the safest way to handle a medication error? A. Keep quiet unless the patient shows symptoms. B. Document only in the incident report. C. Report it immediately and assess the patient. D. Notify the provider after several hours. Answer: C. Report it immediately and assess the patient. Question 17. Which action by a nurse shows correct understanding of safe for medication administration? A. Mixing multiple medications in one syringe. B. Administering medications through an unlabeled line. C. Verifying compatibility before piggybacking drugs. D. Adjusting the 4 rate to speed up drug delivery. Answer: C. Verifying compatibility before piggybacking drugs. Question 18. What is the best response when a patient refuses a medication? A. Hide the medication in the patient's food. B. Educate the patient on the medication's purpose. C. Notify the provider without discussing further. D. Mark it as refused without further intervention. Answer: B. Educate the patient on the medication's purpose. Question 19. What is the nurse's priority action during a code blue? A. Notify family members. B. Begin chest compressions. C. Check the chart for code status. D. Get the crash cart after calling the physician. Answer: B. Begin chest compressions. Question 20. Which finding should the nurse report immediately to prevent patient harm? A. A patient refusing lunch. B. A patient with a blood pressure of 180/110. C. A patient requesting a shower. D. A patient asking to call family. Answer: B. A patient with a blood pressure of 180/110. Question 21. A patient with a history of falls is found walking unassisted in the hallway. What is the nurse's best action? A. Return the patient to bed and apply restraints. B. Ask the patient why they left their room. C. Escort the patient back using a gait belt. D. Notify the provider of noncompliance. Answer: C. Escort the patient back using a gait belt. Question 22. What action best prevents medication errors during shift handoff? A. Use verbal reporting only. B. Rely on the EHR for details. C. Perform bedside handoff with medication reconciliation. D. Delegate reporting to unlicensed personnel. Answer: C. Perform bedside handoff with medication reconciliation. Question 23. A nurse finds a patient's wristband unreadable. What is the priority action? A. Administer medications based on verbal confirmation. B. Confirm identity with family. C. Replace the wristband before proceeding. D. Skip identification if the patient is alert. Answer: C. Replace the wristband before proceeding. Question 24. Which action demonstrates proper sharps disposal? A. Recapping needles after use. B. Disposing needles in a plastic trash bin. C. Using a puncture-resistant sharps container. D. Breaking needles before discarding. Answer: C. Using a puncture-resistant sharps container. Question 25. A nurse notes that a newly hired UAP is using gloves for oral care but not hand hygiene. What should the nurse do? A. Ignore it unless the patient complains. B. Report to the charge nurse. C. Instruct the UAP to perform hand hygiene. D. Provide gloves to reinforce PP use. Answer: C. Instruct the UAP to perform hand hygiene. Question 26. Which of the following must be reported as a sentinel event? A. A patient fall without injury. B. Medication delay of 30 minutes. C. Surgery on the wrong limb. D. Missed dietary tray. Answer: C. Surgery on the wrong limb. Question 27. A confused patient insists on leaving AMA. What is the nurse's priority? A. Call security immediately. B. Ask a family member to intervene. C. Assess the patient's decision-making capacity. D. Have the patient sign a discharge form. Answer: C. Assess the patient's decision-making capacity. Question 28. Which behavior indicates safe oxygen use in the home? A. Storing tanks near the heater. B. Using petroleum jelly for nasal dryness. C. Keeping oxygen 10 feet from open flames. D. Smoking near oxygen with the window open. Answer: C. Keeping oxygen 10 feet from open flames. Question 29. When delegating a task to a UAP, what must the nurse always consider? A. The UAP's preference for assignments. B. Whether the task is within the nurse's scope. C. The UAP's training and job description. D. The availability of other nurses. Answer: C. The UAP's training and job description. Question 30. A nurse prepares to administer an unfamiliar medication. What is the safest first action? A. Ask a colleague how to give it. B. Look up the medication in a trusted resource. C. Administer it based on prior patient history. D. Request the pharmacy deliver it labeled. Answer: B. Look up the medication in a trusted resource. Question 31. Which condition requires contact precautions? A. Tuberculosis. B. Influenza. C. MRSA wound infection. D. Measles. Answer: C. MRSA wound infection. Question 32. What is the nurse's first response when a patient begins choking while eating? A. Call the rapid response team. B. Offer water to clear the throat. C. Begin abdominal thrusts, Heimlich maneuver. D. Check the patient's chart for NPO status. Answer: C. Begin abdominal thrusts, Heimlich maneuver. Question 33. During a disaster triage situation, which patient should receive care first? A. A patient with an open fracture and stable vitals. B. A patient with a small laceration. C. A patient who is unresponsive with no pulse. D. A patient with a sucking chest wound. Answer: D. A patient with a sucking chest wound. Question 34. A nurse observes a coworker diverting narcotics. What is the most appropriate action? A. Ignore the situation unless harm is evident. B. Document the observation in the nurse's notes. C. Report the incident to the nurse manager. D. Ask the coworker to stop. Answer: C. Report the incident to the nurse manager. Question 35. What is the most effective fall prevention strategy for a confused inpatient? A. Keeping the bed in a high position. B. Using bed alarms and frequent rounding. C. Locking the patient's door at night. D. Administering a sedative at bedtime. Answer: B. Using bed alarms and frequent rounding. Question 36. A nurse hears a fire alarm on the unit. Was the first action based on race protocol? A. Contain the fire. B. Activate the alarm. C. Rescue patients in immediate danger. D. Evacuate the unit. Answer: C. Rescue patients in immediate danger. Question 37. Which patient is at highest risk for aspiration? A. A post-op patient on a clear liquid diet. B. A patient with a history of stroke and dysphagia. C. A patient ambulating after surgery. D. A patient with diabetes. Answer: B. A patient with a history of stroke and dysphagia. Question 38. A nurse finds a medication error in the MAR, but the drug hasn't been given. What is the best response? A. Erase the entry. B. Correct the error and inform the charge nurse. C. Ignore it since no harm occurred. D. Give the medication anyway. Answer: B. Correct the error and inform the charge nurse. Question 39. A new nurse is being oriented on a surgical unit. What is the priority safety teaching? A. How to complete shift reports. B. Where to store narcotics. C. Recognizing signs of post-op complications. D. Documenting vital signs. Answer: C. Recognizing signs of post-op complications. Question 40. A patient's foresight is red and swollen. What is the nurse's best initial action? A. Increase the foreflow rate. B. Apply a warm compress. C. Stop the infusion and remove the catheter. D. Flush the fore with saline. Answer: C. Stop the infusion and remove the catheter. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.